Karen, would you have a seat on the table and just tell everybody in 30 seconds what it is we're working on?
My shoulders. When I was young, I was in a car accident and was in a long-term in a neck brace, and that always left me feeling a little bit weak in my upper body. And then I'm a triathlete, and I fell off my bike in 1999, and both arms got frozen shoulder to where I couldn't lift them to shave and stuff. So I went under some therapy, but I have a chronic kind of nagging pain in the upper back, and I always feel like gravity's pulling me forward, and it's always a struggle to get up past it.
Show them your shoulder range of motion so they won't think you still have restricted. She's not too bad in terms of her range for somebody that has adhesive capsulitis. It's resolved nicely. But I was able to look at her earlier. You're going to see some of these reflex influences I was talking about. So do you want to lie down and you can use that as a little bit of a drape?
I wore a skirt with a slit in both fronts. He wants me to lay down in front of a camera.
Okay. Now, I'm going to show you what I do in my clinic every day. Anybody got a watch? I want you to time me. Get your watch out. I'm going to see how close. I'm tired. It's the end of the day. I had to fight it through traffic to get up here, so I might not be as quick as I usually am. But I'm going to go through and I'm going to tell you even what I'm finding as I go, and watch her reaction to what I'm finding when I'm palpating her. I'm going to push the same on both sides to all these areas I'm palpating. There'll be certain areas that she's going to be absolutely sure I'm pushing harder. I won't be. It's just going to be her reaction to that. Observe her reaction to that. When I'm done, I'll go back and treat those. And then we'll have a chance to see if we get a change in her. Okay? How are we doing on tape? Do we need to change? No. No, we're okay. Okay, good. All right, so here we go. You ready? Mm-hmm. Okay. So here we go. Start your watches right now. Here we go. Okay, we've got coccyx is okay. She's got SI on the left here. She's got lower lumbar on the left. She has ribs, diaphragm on the left side. You see that reaction here. L1 on the left, L1 on the right. She has costosternal restriction on the right side, not the left. She has bilateral rotator cuff, infraspinatus teres minor. You saw that reaction there. Upper T-spine on the right. She has bilateral first rib, not second involvement. She's got cervical-thoracic junction restriction on the right. She's got ligamentum nuchae on the right. There's that, not on the left. She has suboccipital involvement on the right, not on the left. She's got involvement in the occipitalis muscle on the right, not the left. She has the temporal parietal on the right, not the left. And she has the masseter temporalis. What's the time? What was it? 106? Oh, well.
And he roughed me up.
In
a minute.
What was it? I didn't hear that. What'd you say?
First date.
Okay. Now, just I want to. Karen consented to be up here, and you know when you volunteer to be a patient, you realize you probably shouldn't have done that, and now she's thinking that. But I'm going to now fix what I found as best I can, because did you see some of these areas when she reacted to my palpation? Remember we said the 4 Gs: gas, grimace, groan, grab. She had some of those there. They're not all there all the time. But she clearly didn't like some of these areas I was palpating. She could feel the ones that you couldn't see even when she didn't react. Couldn't you? Mm-hmm. The areas? Okay. So she knows even if you don't know what the areas were that were involved, and now we're going to see how fast we can fix those. Okay? So what I would tell you is just relax. There's no manipulative work in this. And by the way, I would not palpate a normal patient this vigorously when I'm doing this. I have to show you, and if I do this, I could put her on her stomach. But, you know, this table isn't really set up with a face piece, but you can palpate people prone. You don't have to do this supine. So you can do a prone assessment so you don't have to reach under people. Okay, let's just see what we can do to make some changes. Can I have your thumbs a second? Is that tender here? Mm-hmm. Okay. What's the only muscle that we have that other mammals don't have in the hand? The opponents. So the ability to oppose seems to be a real important thing in humans. Otherwise it would have been in other mammals. Now relax, put that back down. What's this feel like here now?
It's not tender.
Here?
It's still tender.
Is it different than it was?
Yeah, it's not as sharp.
Okay. How about here? This was a bad thing before here?
It was.
How's that now?
It's like maybe 50%. There's still a hitch in there.
Here? Suboccipitally, what's that feel like there?
Relief.
Okay. Now, that's already 50% better, and I didn't treat anything near where her pain was. And I didn't treat Hoku. For those of you that know acupuncture, I'm on the other side. I'm not on the large intestine 4 side. We'll go on and do a few more things, see if we can make some more changes. I'm pulling her hair. You can't see that with the camera, but I'm actually pulling her hair. Why would I do that? I'm gapping the gala ponderosus because that has a direct attachment to dura through the cranial sutures.
I can feel it in my occipital area.
She can feel it in her occipital area.
It's like a heat.
Yeah, that means there's increased blood flow. This is a woman who's been symptomatic since 12, you said?
Mm-hmm.
And you're a little older than 20 now? Where? I'm pulling on the front area here as close to where the hair ends, right here, and I'm back behind the ear here at the back margin of the posterior fibers of the temporalis muscle. Okay. Eyes closed for me. Now I'm going to try to open her eyes. Can you take your hands for me? Can you open and touch them, the little finger, cross your arms in front of your chest, and there you go. Hold right there for me. Got that? Hold that. Nice thing about this work is we can multitask. I can have her doing something that's correcting. This is correcting her infraspinatus teres minor while I'm working on her SCMs. Interesting phenomena if you haven't looked at it. Go back and look at your anatomy book. The muscles that are innervated by cranial nerves typically don't have tendons. There are exceptions, like the temporalis, but many of these muscles are just muscle fiber into bone and no tendons. Sometime later we'll talk about why that is. Now you can let go. Relax that. Put your arms down at your side. What does this feel like now?
Non-tender.
Here?
Non-tender.
Ligamentum nuchae, which was really tender before?
It's significantly improved. It's a little tender.
Here?
Nothing.
Nothing. Here?
Nothing.
Open your mouth for me. Put a finger between your teeth. Do you realize that the masseteric reflex is the only unopposed reflex in the entire body? It's documented in medical texts, although nobody talks about it. I figured out a way to oppose the masseteric reflex by stimulating the there you go, posterior belly, digastric, anterior belly, as well as the mylohyoid. Okay, what does that feel like now?
There's nothing.
We had, if you remember this, diaphragm, left side, remember that? Okay, here it is here. What does that feel like now?
Yeah, the same now.
Same now? Okay, we had L1. L1 doesn't bother her. We had lower lumbar, and we had SI. How does that feel? Why don't you come sit up, see how you feel.
Am I taller?
How's your upper T-spine feel?
Like free.
So was the visit. Okay. Thank you. Let me know how you do. Okay, now, could I do more? Yes, but for the sake of time, I want to try to treat a few other people so you see the pattern to this, and you can see the, I don't know, were we 8 minutes or so on her? We weren't too long. Huh? What were? Okay. The goal is to take the 1-minute nociceptive exam and other things you saw me do, like the thumb, and there's a lot of other peripheral areas I also examine, like the peroneus tertius, to take those and normalize those so they're as good as the other side. That's as simple as it is.